If an official White House Christmas list exists, the passage of health care reform legislation is most likely on it.
Members of the Senate joined their colleagues in the House of Representatives to pass a landmark health insurance reform package, legislation that brings us toward the end of a nearly century-long struggle to reform America's health care system.
Early Christmas Eve morning, President Obama touted the efforts of congressional Democrats to pass the Senate health care reform bill 60-39 with no Republican support. The Senate bill will be merged with the House version passed in November. Both pieces of legislation, despite having a shared goal to cover more of the nation's uninsured, have their distinct differences. The House bill would cover more people, as many as 36 million, according to congressional budget analysts. It would cost approximately $1 trillion over the next decade. This compares to the Senate bill that would cover 31 million people at a price tag of $871 billion.
This is a victory for the American people. Those fortunate enough to have health insurance will be able to keep theirs, and those who do not will be able to have health insurance.
The House version of the bill would also give more control to Congress to monitor and regulate insurance costs, while the Senate bill would leave that responsibility to individual states. Many health policy advocates and liberals, especially those upset over losing the publicly funded option, are pushing for the House version of the bill to pass.
At the same time, it cuts costs, the waste, the fraud, the duplication endemic to our system, and at the same time, it covers 31 million people.
Conservatives desire a less costly and government-controlled option.
When you look how this legislation was passed, the sort of backroom deals that were done, and the senators that were taken care of specifically in a way that I think even rubbed even some Democrats the wrong way.
For President Obama, a day closer to victory for the most important item on his domestic agenda.
If passed, this will be the most important piece of social legislation since the Social Security Act passed in the 1930s.
There are still a number of procedural steps that need to be made. Negotiations with the House version of the bill will continue over the holidays. Top lawmakers say they expect to put a version of the bill that President Obama can sign into law by early February. Colin Campbell, the White House.